الرحمن الرحيم والحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد خاتم النبيين وبعد. أنا هتكلم دلوقتي عن الكلينيكال لوجيك أو هستكمل كلامي بخصوص الكلينيكال لوجيك أو المنطق الإكلينيكي. وقلت إن اللوجيكال ثينكينج ده part من or one of the important clinical skills اللي احنا بنسميها الثينكينج سكيلز، واستخدامها في clinical decision making. That the clinician should be logical in thinking. وده this is the what we call the logician clinician. logician على وزن musician، زي كده musician يعني موسيقي، logician يعني منطقي، يعني a man who follows or a woman of course, a man meaning a human who follows logic and uses logic as the main tool in his or her thinking as one of the most important mental processes. زي ما قلت قبل كده ان المايند the most important two functions of the mind are consciousness and of course with consciousness orientation and alertness and awareness, and awareness is consciousness, with the two divisions of consciousness, which is level of consciousness and content of consciousness. Consciousness is number one, and number two is thinking process. And the sources of thinking are knowledge. How can the clinician, man in general, think or uses his mind? And قلنا قبل كده the most important thing in any profession is mentality. حتى للاعيب الكوره المنتاليتي، حتى للرجل الاعلام المنتاليتي، حتى للرجل العسكري المنتاليتي. فقلنا المنتاليتي is everything. وزي ما قلت قبل كده ان the mind is everything، يعني العقل هو كل شيء في الحياه، كل شيء في الحياه بصوره عامه، وكل شيء بصوره خاصه في البروفيشن، في المهنه. ومنها and one of the professions is being a clinician or a healthcare provider. سواء كان physician أو surgeon أو nurse أو pharmacist أو radiologist أو pathologist, all of those are called disciplines in clinical medicines, and they are all included under the heading of healthcare providers. The healthcare provider or the clinician should have a mentality, and one of the most important aspects of the mentality is how to think. And the most important aspect of thinking is what we call the logical thinking, يعني التفكير المنطقي, because if the clinician follows the logical thinking, he can or she can reach to the proper management, and she can be able, or he can be able, the clinician I mean, to manage the patient properly from diagnosis going through treatment and taking therapeutic decision or designing or tailoring the therapeutic approach to his individual patient. So logic. And logic, as we all know, what's meant by logic in general? Logic by definition is the study of correct reasoning. It is the study of correct reasoning and valid, and also in addition to being able to reason, that is correct reasoning, is what we call the valid inference. يعني هو القطب العربي، يعني القدرة على التسبيب reasoning والاناليسيس التحليل و reaching to a conclusion and deductions والاستنتاج والاستنباط. So the ability to properly and be able to carry on correctly reasoning, analysis and conclusion or deduction, that this is called the logic. So it is a study of correct reasoning and valid inference. أو بالعربي again هي اللغة العربية هي القدرة على التسبيب والتحليل والاستنباط والاستنتاج طبقا according to the rules of science and according to the evidence-based guidelines or evidence-based scientific guidelines. لأن الخروج, and if anyone deviates out of this science-based rules of analysis and deduction and abstraction and reasoning, he or she will be illogical, غير منطقي. And so the decision will be incorrect decision, will be false decision, will be wrong decision, because the source of the decision is not proper. It is illogical thinking. So the clinician should follow what we call the logical thinking. يعني يجب أن clinician يكون logician زي ما قلت. Again I will repeat it again. Logician clinician. Logician clinician يعني clinician منطقي، يعني رجل يمارس العملية السريرية أو الطب السريري clinical medicine in a logic way، بطريقة منطقية سليمة with correct reasoning, analysis, conclusion and deduction. يعني بتسبيب سليم ليه هو خد القرار ده، why he or she takes this decision in the diagnostic process or in the diagnostic step, and then why he decided this therapeutic plan for this patient according to logical rules. This is the ability to reason, to analyze and to conclude and deduct. إن هو يستنتج ويستنبط الأشياء، وبالتالي can reach to the and it involves a group of rules that guide correct thinking, and so will be able to reach to the logical conclusion and logical clinical decision. And in general, the logic, as I mentioned, it is a sub-discipline or it is a branch of philosophy. It is the most important branch of philosophy. Philosophy is the mother discipline, and logic is sub-discipline of philosophy, because philosophy, it is a discipline which it is a discipline in knowledge. Because as I said before, philosophy, in the opinion of many philosophers, it's not a science by itself. In some opinion, it is a science, but in other philosophers, يعني بالنسبة لمجموعة كبيرة من الفلاسفة، الفلسفة ليست علم. It is different from science. It's not a science. ولكن discipline in knowledge, because as I mentioned before, there is a difference between knowledge and science. Knowledge is broader than science. Science is a discipline in knowledge, but there are other disciplines in knowledge. But knowledge is broader term than science, and science is a narrower term than knowledge. So science is a knowledge, but not any knowledge is science, because some disciplines of knowledge, they cannot be considered as sciences. Science is a discipline of knowledge which is concerned with the phenomena and the things, how and what is the phenomenon and what is that thing, and how it occurs, how it happens, what are the rules or the laws or the principles which control this phenomenon or this concept or this thing. For example, like the physics. Physics is a science, and we have the physics of sound اللي هو فيزياء الصوت، وفي الفيزياء الضوء اللي هي الoptics. So these are optics deals with the optical phenomena and the light. And the physics of sound, this is another speciality in physics. Chemistry is a science, biology is a science, but philosophy is different. Philosophy is a discipline and it's not a science, because it's concerned with why things occur. It deals with what is behind phenomena, what is behind things, and it involves the rules and the concepts and the facts which are concerned with existence, with knowledge, with reality, with truth, with ethics and values. So, and that's why it includes sub-disciplines like the metaphysics, اللي هو علم ما وراء الطبيعة، ما وراء الأشياء، عمق الأشياء، لماذا تحدث الأشياء. إذا لماذا تحدث الأشياء والظواهر، هذه هي وظيفة الإيه؟ الفلسفة. أما ماهية الأشياء وكيف تحدث دي العلم أو العلوم. ولذلك الساينس يبحث عن what and how things happen. But philosophy is concerned with why things and phenomena happen. Simply. وفيها علوم زي ما ذكرت، زي علم الميتافيزيكس وزي الابستمولوجي اللي هو نظرية المعرفة أو الثيوري اوف نوليدج، ابستمولوجي والأونتولوجي. فالابستمولوجي والأونتولوجي والميتافيزيكس these are other sub-disciplines of philosophy أو branches of philosophy exactly like logic. But logic is the most important sub-discipline of philosophical branches أو philosophical sub-disciplines. If we consider philosophy as a discipline of knowledge. فهي نوع من المعرفة، ولكن هي الفلسفة نوع من المعرفة أو فرع من فروع المعرفة أو نظام من أنظم، discipline يعني نظام، في داخلة تحت العلوم المعرفية أو النوليدج. أما الساينس فده ديسيبلين آخر في النوليدج. كده قلت إن كلمة نوليدج أوسع من كلمة ساينس، أوسع من كلمة ساينس. فده واللوجيك زي ما قلنا we come back again to the logic, general logic and clinical logic اللي هي المنطق العام والمنطق الإكلينيكي. In order to know the clinical logic, you should know the principles of general logic, which I mentioned it a few minutes ago. And an important point in logic, including the clinical logic, is don't generalize. We can generalize because generalization, as we say in logic, lead to wrong conclusion, lead to wrong result. So we should not use generalization when we are talking about issues. There is nothing called مثلا all the physicians are bad, or all women are bad, or all Egypt or all Chinese people are not good. No, this is not right. Here we generalized. Or generalization is against logic. Same. When we use one drug to treat patients with the same disease, this is not logic, because every patient is different from the other. So here, generalization using the same drug or the same concept in all patients in logic clinical medicine or in clinical logic is absolutely wrong. So don't generalize. That's why, and this is one of the roots why we individualize therapy, or we use what we call individualized treatment or personalized treatment or precision medicine, because every patient is different from the other. The phenotype is different, the genotype is different. So from the appearance, the physical point of view, people are different, even if they have the same disease. How the disease affected the body, this is different from patient to patient. Maybe in one patient there is nephropathy more than retinopathy, or there is no retinopathy. In another patient there is neuropathy and retinopathy, but there is no nephropathy. Maybe the cardiac disease, which is macrovascular disease, is more prominent. So here the details of the phenotype of disease, that is the physical characteristics, including symptoms and signs, are different in quantity and in quality from patient to patient, between patients. So we can't use the same drug in general to treat all cases, or we can't use the same, if we use the same group of medicines, we should select which drug of the group of medications we should use for this is suitable for this, can fit this case. For example, if we use sulfonylureas for treating diabetes, we should understand which will we use the first generation or second generation or third generation sulfonylurea? Will we use one with longer duration, or as long acting or short acting? Or we can't use sulfonylureas in this particular patient. Maybe. Or if we can use, which one of the sulfonylureas I will use? If we use incretin-based therapy, can I use, for example, the GLP-1 receptor agonist, or I can't use? Maybe I will not be able to use, but I can use the DPP-4 inhibitors, which is the second group of incretin-based therapy in diabetes. Also the same for SGLT2 inhibitors, for insulin sensitizers, for insulin secretagogues, that's medicines which promote insulin secretion. So it is, this is how we can generalize. If we generalize, this is against clinical logic. So one of the rules of clinical logic: don't generalize as regards diagnosis. Also in the diagnostic process, even if the diagnosis is the same, but the details of the diagnosis may be different. As I mentioned, the diagnosis is type 2 diabetes. Diagnosis is diabetes, but maybe it's not type 2. It is diabetes in adult, but maybe diabetes in adult is not always type 2 diabetes. Maybe a type 1 in adults, what we call the LADA syndrome, late autoimmune diabetes of adults. We say it LADA, which is type 1 in adults. Or maybe MODY, which is a monogenic diabetic type or diabetic syndrome, which develops also, and it overlaps with type 2 in adults, the MODY syndrome, maturity onset diabetes of youth. Or it may be, as I mentioned, LADA syndrome, that is type 1.5 diabetes. We say this is late type 1 in adults. Or maybe classic type 2 in adults. So not all diabetes, not every diabetes in adults is type 2. So we have to, it is diabetes, but not type 2. It is diabetes because there is biochemical markers of diabetes. There is high fasting, there is high 2-hour postprandial, there is high above normal hemoglobin A1C to have the full diagnostic criteria of diabetes. But which type of diabetes, which category of diabetes, which type of the diabetic syndrome, or which subtype, here is the second question. The details is different. The phenotype is different. So the diagnostic details and the clinical details of this particular case, having the same disease, is different from patient to patient. That's why we should not generalize. And this will make a difference when we come to apply medications, that is to select a therapeutic approach. For this case, for example, when there is obesity, there is insulin resistance, here lifestyle modification is very good, especially in mild cases, in early cases. But when we come to cases, advanced cases, late cases, with very high blood sugar and maybe also presented to me with complications, lifestyle modifications alone is not enough. So we have to combine lifestyle modification with combination therapy. And here, combination therapy in management of diabetes, type 2 diabetes, which is very, very important for proper management of the case. And which type of combination I will use? Sulfonylurea plus metformin, or metformin plus other medications than sulfonylureas. Maybe this case is not suitable for sulfonylureas, so I will use other medications, because sulfonylureas can cause hypoglycemia, can cause weight gain, and this patient has a hypoglycemic unawareness or is liable to hypoglycemia, or fragile elderly diabetic, so I can't, and he gets or she gets recurrent nocturnal hypoglycemia, so or even daytime hypoglycemia, so I can't use sulfonylureas in such cases. Or maybe I have other contraindications to use sulfonylureas, for example. So we should shift to select other medications. Like this is the rule of generalization is against the clinical logic, and we should not generalize, because this will make us fall into mistakes in the diagnosis and in the therapy, that is, in the treatment of the case. So this is how to be logic in clinical practice, as I mentioned. That's why I mentioned that the clinician should be a logician clinician and use what we call the logical thinking. لأن قلت إن التفكير الكلينيكي في حاجة اسمها critical thinking وحاجة اسمها logical thinking. هي logical thinking and critical thinking is the best to use in thinking مصدرها، هي دي مصدر الايه، مصدر الثينكينج اللي بستند اليه هي المعرفه، واهم حاجه في المعرفه is the knowledge, and the most important knowledge to use is the logic، استخدام المنطق طبقا ل according to the what is the medical science says and what does the evidence based medicine says, what is the guidelines for this disease or for this syndrome. For example, guidelines for management of diabetes, type 1, type 2, MODI, whatever, the type of the guidelines for management of hypertension. So it's based on the knowledge, evidence-based medicine. In addition to, as I mentioned, wisdom-based, which will determine the details, wisdom-based approach. So there is what we call evidence-based approach, we have wisdom-based approach, we have knowledge-based approach. It should be combination of the three. Your knowledge, that you have knowledge of the diabetes, you have wisdom because you had very good experience in treatment, and number three, what is the scientific guidelines, the national guidelines say all over the world, the American guidelines, European guidelines, Asian guidelines, although I have some concern about using the guidelines blindly. Show me your patient, I will tell you the guidelines, because this differs from patient to patient, and here is the logic. Because using the guidelines blindly and apply it to all patients with diabetes, whatever the age, whatever the duration, whatever the severity, is wrong. Because a patient differs from case to case depending on the type of diabetes, the age of the patient, the sex of the patient, the duration of diabetes, the severity of diabetes, there is complications or no complications, and the presence of other comorbid conditions like dyslipidemia, like hypertension, like hyperuricemia, like heart failure, like renal failure. All of these factors we should consider in order to reach to the best therapeutic plan for every individual case and to be able to apply the rule of precision medicine precise. So here what we call استخدام المنطق, or how to use the clinical logic in order to avoid falling into mistakes in the management of your patient, and in order to minimize clinical mistakes in diagnosis and in treatment, and to at the same time to decrease or to prevent or to minimize patient harm. الإضرار بالإيه بالمريض, because as we all know safety is prioritized, يعني مقدمة prioritized than efficacy in the medical management. You should be safe in clinical practice before being effective in clinical practice. لو إن لم تستطع أن تفيد المريض فعلى الأقل لا تضره، زي ما دايما بقول لتلامذتي. Here this is very important in the clinical logic in using the clinical medicine, in using logic. And as I mentioned, this logic is based on the rules of science and what we call the evidence-based medicine, in addition to knowledge-based and wisdom-based. And wisdom-based, as I mentioned, depends or is related to your medical practice and your experience. This is in general the rules of المنطق الإكلينيكي أو clinical, using clinical logic in patient management in both the diagnostic step and in the therapeutic step. وهنا يدخل بقى ويجي الكلام عن ان احنا زي ما قلت ان الكلينيشن لازم دايما يفكر in a tidy organized manner، يعني لازم يكون دايما تفكيره تفكير منظم ومرتب، لانه if he is not tidy and if he is not organized due to any factor related to the environment, related to the stress of work, related to the هو under stress due to big number of patients and is unable to decide correctly because he want to finish the patients quickly, so his thinking will be disturbed and there will be no proper thinking and there will be no tidy thinking, there is no clear thinking due to stress related to the work environment, so there will be clinical mistakes. That's why you should have a tidy, clear thinking with good usage of clinical logic in clinical practice. This is very important to notice, and this is in short about the using clinical logic. المنطق الإكلينيكي والقدرة على التسبيب والتحليل والاستنتاج فيما يتعلق بالعملية التشخيصية بداية من عملية إدارة المريض بداية من التشخيص إلى العلاج زي ما قلت. أشكركم and my best regards to all of you. Professor Dr. Tarek Ali.